Hey guys, welcome to the Is It Legit podcast. We're going to be talking about the medical industry. We're going to be talking about hospitals, things that are very near and dear to our heart, things that really frustrate us and probably frustrates a lot of you guys. Before we start, we really encourage you guys to just please hit the like button. Please subscribe. It makes a huge difference for us. And so even if you don't subscribe, even if you hate our stuff, please just hit that like button and then hit that exit button afterwards. Give us a little something.
Yeah, we're not desperate at all.
Yeah. We have like one viewer here. Today we're going to be talking about some of the biggest complaints with hospitals. I know that I personally have had so much frustration with my experience with my PCPs, my primary care providers, and some of the other hospital experiences. I know that this is not just me. I know that this is a universal thing. A lot of people, it's actually not even just in America. I watched the thing about hospitals in Korea that there's a lot of issues, right? It's a beautiful thing, but we're trying to run it as a business. And that's where a lot of problems start arising, because when you're money oriented, when you're money driven, things break. People don't get the care that they need. And it's really just about, how do I make the most amount of money? So let's give this guy a surgery when they don't actually need it. Let's give this guy that statin or that pill that they don't actually, there's alternatives for, but this is what's going to make the hospitals the most amount of money, even though there's a lot of side effects. And so that's what we're going to be talking about today. And I'm very excited. One thing I just want to say right off the bat, and I want to hear your thoughts, are one of the things that I actually use AI to uncover is some of the biggest complaints. One of them is dismissal of patient concerns, medical gaslighting. Many patients report that their symptoms are ignored or minimized by clinicians, leading to worsened conditions or emergencies. This issue disproportionately affects women and Black patients, contributing to health disparities. I will tell you that I have personally experienced this. I've been super frustrated at my doctors for dismissing some of what I feel like are real issues. Now, I get the dynamic and the frustration with doctors where they're like, listen, stop looking on Wikipedia for your problems. There are people who go kind of overboard with that. I understand that. Yet, I feel very strongly that there are things that I struggle with that I have discovered on my own. We're going to talk about that doctors tend not to give too much credence to, because it's not like an emergency. And honestly, I feel like they don't care as much. And they always go for like the quick fixes. I think I was 30 years old. I had someone who I had some back pain issues, and he was talking to me about pain management rather than actually fixing the issue. Literally, let's get you on pain meds. And, you're in your 30s now. It's just what you're going to have to deal with the rest of your life. So I've been frustrated. You're broken in many ways. No offense.
Thank you.
But
you.
You're hopeless. No, I'm kidding. Yeah.
I feel suddenly a depression
Yeah.
on my spine.
As a doctor, you're just going to have to use pain management.
WebMD? Is that what makes you a doctor?
Yeah, actually. So what are some of your experiences? Your wife is a practitioner, so that gives you obviously some special insight. What have you experienced about some of this medical gaslighting or some of the problems with the hospital systems?
Wow. So I think I'm in a pretty unique position, because I've been both married to a practitioner. I know you have a lot of doctor friends as well. I've been married to a nurse practitioner that used to be a nurse, that's been in the industry for like 15 plus years. I've listened to all of her stories about all of this stuff that we're going to talk about, all of it, multiple times. I can give you specific cases, stories. But then on the other side, because that would make me biased toward providers, right? If you just heard that. But then on the other side, I've had I've had a lot of surgeries that you keep teasing me about. So hopefully you won't ever.
If he just breaks apart in the middle of this podcast.
Yeah. Sometimes I get up from my chair and I'm like,
yeah,
that's it. But I've also, unfortunately and also fortunately, and I'll explain why, have had 7 surgeries on shoulders and knees that forced me to learn more about the system because I wasn't happy with the outcome, just like you, right?
Yeah.
Which you'll talk about more.
Yeah.
And the fact that the way you go into an office, so think about it, the moment you head into an office, you've been, conditioned by TV, by your parents, just by the establishment itself, that this is a place of trust. There's people with clipboards, you sit at the waiting room, you're waiting, not them, you're waiting. And you're twiddling your thumbs, you're checking your social media. Oh, they're late, it's okay. And the guy in the coat comes in, right?
Yeah.
And then you expect that person to, help you. And a lot
Do
of
what's
times,
best for you, your
exactly,
best interest. Yeah.
like look out for you, give you remedies and this and that. But I think often cases it's not. Sometimes because of the things that you said, but also sometimes because of the limitations of the hospital system, which I think we can talk about. But I think a lot of this has to do with the fact that, please disagree with me if you want, but the fact that they don't have time to deal with patients, and they have quotas to meet.
Yes.
This is a real thing. Like, this is not made up. Like, I'm married to one. And she has to have a certain number of patients. So then think about it. Like, how well can you're speed dating. Like, how well can you figure out the entire, because not all illnesses are actually, the body. Sometimes it's in here. Psychosomatic. In fact, that's what some people say, fibromyalgia, Crohn's disease, all these inflammatory, what's the word? These conditions have to do with is here. They have 15 minutes to get your whole history and to ask you.
You could read the chart, but it's like, come on, like that's not enough time.
And then you have to chart too afterwards.
Yeah.
So you're like, so I believe that the way that medicine is practiced, there's a lot of bloat in the system, the way that insurance has to be, covered, and, you have to get reimbursed now. You're not just a doctor, you're also like an insurance claim person. Who teaches you about that?
And I'm not talking, not just as a PCP, which, that's like the highest of a nurse practitioner is at the highest, but there's also doctors. My doctor friends are having to do that. So they're doctors, but they're fighting with insurance companies to get your care.
I've done that before. I've had to go out of network for my knee surgery. I paid $40,000 to $50,000 for one knee surgery. I've had to go through the whole rigmarole.
Yeah.
I had to hire somebody to help me. I looked at the paperwork, and it's like, that's one case for one patient. The doctors at my wife's hospital, Optum, used to be Everett Clinic, Optum, they have to see like 25 plus patients a day.
How?
There's 12 hours.
That's crazy.
That's including bathroom breaks, lunch breaks. I mean, it's crazy. So anyway, I think for me, it's a lot of the system kind of forcing practitioners to be in this little box. But what are your thoughts?
I do know that a lot of doctors, they work off of RVUs.
Yes.
And RVUs are basically units where it's like, okay, if I do this, if I do that, then it means I brought more income, or I've seen more patients. I'm bringing more income. I've done more procedures. I've done more this and that. Yep. They're incentivized to do procedures, to do surgery. So let me give you an example. I had issues with my shoulder. I was bouldering often, and I like totally ripped it. Something bad happened, and I was in a lot of pain. And so I was on a 2-year journey about my shoulder. I went to 5 different doctors. I was passed around by 5 different doctors. I heard 5 different solutions, right, on the whole thing. Most of them wanted me to do surgery. They want to do a what do you call it? Rotator. No, it's whatever that tendon is. That rotator cuff tear. They wanted me to do that surgery that a lot of people get. Yeah. And I wanted to get a second opinion because I'm like, well, that's going to take me out for like 6 months. It's expensive, et cetera, et cetera. But they were like, this is what you have to do. And they were so convinced of it, right? I had to go. So this is what I had to do. I had to talk to my doctor friend, and he has a friend who specializes in the shoulder. And what he was saying was, hey, based off what you've told me, and by the way, I've heard some really crazy answers, like, oh, you have like calcium deposits, which that I'm sure that's true. But then he was talking about like doing this new barbitaging, or there's this new procedure that you just suck out the calcium. And then I asked another doctor, and it's like, what? That's ridiculous. That's not even possible. Anyway, I heard some different things. This one guy, a friend of my friend, who's a doctor, said, oh, it sounds like all you need is a cortisone shot. And that's probably going to give you almost full relief. I've done this many times. I ended up getting a cortisone shot because I was like, let's just try it. Gave me a cortisone shot, and I haven't had an issue. That was several years ago, by the way, when I got this. I haven't had an issue since. My shoulders work fine. I work out just fine. I do pull-ups now. I mean, I could barely even like put my hands up like this because it was in so much pain.
Yeah, I remember that. Yeah.
Yeah,
I almost forgot about that. Yeah.
Really bad. And so all this to say is it's just interesting how so many doctors are so pro surgery because they're financially incentivized. They're also financially incentivized for you to be in that room and for you to get out of that room as soon as they can get you out of that room.
Yeah.
That's the unfortunate part.
Do you mind if I share a story? So there's a guy called the Carnivore MD online, Sean Baker.
Yeah.
He was an ortho surgeon, joints, right?
Sure.
He was one of the top guys, some state, I can't remember. But then he went on this kick like us to discover alternative ways of fixing yourself, doing rehab, diet, all this stuff. And then he mysteriously got written up by the board because he wasn't doing enough surgeries, because his patients were like getting healed without surgeries.
Oh, wow.
And then fast forward to now, he is, I think, out of practice. I mean, you guys can Google this, right? He's out of practice. They were like complaining basically that he was not making enough revenue for the hospital. And these stories are everywhere, right?
Everywhere.
I mean, just like us, like we are also in a system. Everybody's in a system, right? But I think you have to understand the system that you're in. Like the medical system, the insurance. I mean, the budget for medical in the United States is $1.2 trillion a year. And experts indicate that about 30% of that is bloat because of how the insurance claims have to be made. There's all these plans that are inefficient. Like, have you tried shopping for insurance? I mean, it's crazy.
Yeah.
I mean, luckily my wife has excellent healthcare, and I'm just like, she just pays it. But us as independent contractors, like you.
I recently had to do it.
Yeah. I mean, how's that experience?
It wasn't good. I mean, there's a lot of different factors. You got HMO, you got PPO, you got, in-house doctors, and then you have to, out of care network, and then you have deductibles. Like, okay, how do you choose a deductible? Not a great experience.
Can we, so I'd like to jump to, it's kind of related. So long wait times. You want to comment on that?
Okay, for people who feel that, man, like I feel like I should be getting checked earlier. I feel like I have a real problem, and but they booked me like 2 months later.
Yeah.
Guys, that is a real thing. And it's not necessarily because your problem isn't a serious thing.
Right.
It's that there's other people with more serious problems that need to be cared for, and that's really what is going on right now. And people are waiting so long. There are things that I thought were like serious issues that I would have to wait for months before I got checked. But it's because they just don't have enough staff. That's the biggest issue right now. The biggest complaint I've heard from a bunch of doctors. We are so understaffed. Like and that's a whole nightmare. Nurses went on strike. They're becoming traveling nurses because they're like, well, you're not paying me enough, and et cetera, et cetera. And so now doctors are doing a lot of what nurses are doing, and they don't have enough time in the day. 25 patients? Are you out of your mind?
Or more.
Are you out of your mind? Like, how many clients do we see a day?
I mean,
to see 25 patients a day, that's crazy.
I'd lose my mind.
Yeah.
Yeah.
Anyway, so you had a
yeah. Well, the long wait times. So this is a real story. Also, remember, we have people in the medical industry that we could call and count on.
yeah.
So I am a lucky person. We are lucky people. But I called last November, okay, because I had a colonoscopy done, which is a separate story. I'm only 38, but I did have one done. And the first step is to find a primary care physician because I didn't have one. I just would find my own specialist. I would research them. I would look up the reviews, blah, 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 blah. I just go direct. But they're like, for this one, you need a PCP, primary care specialist. Okay. Or primary care physician. So I called Optum and I said, well, can I get a PCP? And they're like, yeah, you can. It'll be May of 2025. I'm like,
I experienced that before.
Wait, that's
I totally experienced that.
months. No, that's not going to work. So then I was like, Jessica, what do I do? She's like, do that, da, 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 da. And then I got an appointment, out of the hospital system somehow, but in network. I don't even know how that works.
Yeah.
But I got into Swedish and I found one and then so on and so forth. So I think there is a lot of pressure on our friends in the medical system. And I think to go back to my previous point, you kind of have to understand the system that you're in. And sometimes it's not just you, but it is the system.
It is a system. I mean, you can't even blame the doctors necessarily or the nurses. I mean, it's just the system is breaking and it's breaking fast. And I think a lot of the thing is, I think a lot of patients are starting to feel that. We're so focused on, I feel like there's a lot of lack of attention, even when you get to the doctor's office. So let's just say you wait 8 months to talk to your PCP, and then, you talk to them and it's just like, you feel like there's like a lack of that personal attention. It's kind of like the whole, you have to diagnose before you prescribe. You have to at least like let them feel like they're being heard, but the doctors don't want to hear it. They're like, oh, I already saw your chart. This is what you need, right? It's like based off of what you wrote down, this is what you need. And I get that. It's like, you don't want to waste time, but it's not a great experience for the patient. But that's unfortunately what our doctor friends and, nurse practitioners and nurses are forced to, because of the way the system is like, no, you gotta get in and out. You gotta keep going. You gotta make money. And it's just really bad. I think the other thing that, we're dealing with is there's just a lot of a lack of preventative care. And I just don't think we care about preventative care as much. I think doctors aren't really dietitians, which, food is medicine. Like there's so many ways that you could heal your own body by just eating the right foods and doing this and that, but they're just not trained on it. And so,
right.
We're having to, I think one of the biggest issues that whatever you think about RFK Jr. Is whatever. I don't really have great thoughts about him, but for me, I understand the concept of we have to have more preventative care, because that's why we're having so many hospital breakages, because we're not caring about the diet. Like it's real, like it goes back. Like it's the system. It goes behind the system. This part of the system is that we are not taking care of our bodies, that these food industries are giving us red dye 40, where they're giving us trans fats and carbohydrate hydrate heavy meals and folate in our wheat and all this stuff that are causing a lot of these health issues. And we're wondering why these hospitals are way overworked, because we have a big issue with a bigger industry behind there. Of course, everybody kind of knows this. If you have any brain at all, you'll know that the system is forget our diets. Let's just eat whatever that's cheap and let's just give them whatever. They'll get sick. And who comes to the rescue, right? It's like, okay, yeah, you can get surgeries, but what are people prescribing? Prescription drugs, right? And so that's another industry that's conducting a lot of these studies. And you're seeing a bunch of these guys prescribing things that they can make money on. And that's the other ugly part of this whole thing. It's like they are prescribing things that have tons of side effects, but that's what's actually making money. And so it's like, okay, take that statin, right? Forget the side effects, but take that statin because that's how they make money. And so I think it's there's a myriad of issues within this hospital system, and it's breaking. We're spending all that money, but we still don't have enough money. We don't have enough money for the equipment that the doctors need to be able to fix this patient. Or we don't have enough money for the doctor to take less patients and give a little bit more care. What my doctor friends signed up for was not what they actually signed up for. When they saw on TV, what they saw was not what they thought they would experience when they're actually in the field, because now they're literally weirdly running a business. They're having to sell things. Like,
they definitely are.
I have to sell this
right
surgery. I have to sell this, prescription drug. And it's like, what the heck happened? Why does the doctor have to talk to the insurance companies? Isn't that something that the administration should do? So,
I mean, I imagine that if you are a practitioner, doctor, the 100 different jobs in a hospital that make things happen, you're probably, disenchanted a little bit. Like, I thought it was this, but now it's this. A little bit of the switcheroo. I've even heard of stories, we were just talking about this, of medical schools are lowering their standards because there is a lack of doctors. Students who are trying to become doctors.
Yes.
So imagine in a generation, like when our kids are older, the joke that I heard some doctors say, I can't remember if it was a show, they said, what do you call the guy who graduates last in his class for medical school? A doctor. So no matter what, like even if you went to Harvard, or, whatever, you're still a doctor. So when you walk in, you're just trusting the system, the lab coat. This guy is telling me what I need. Take this, take that, prescribe this, prescribe that. And just to give a positive and a good story of when the system can work for people. So I'll share the story about my mother-in-law, right? So again, very fortunate, very biased, because I actually have my wife in the system that can shortcut us and like talk to the right specialist and push for more testing. I'm almost a little guilty of that. But anyway, my mother-in-law goes in for a headache. She's had headaches for a long time. Okay, well, what's going on? Are you drinking water? Or, how's your salt intake? All the little things. And then this super smart guy, this like genius level guy who's on the administration side, but also a doctor, he like pulls Jessica to the side and says, I'd like to do a little bit more testing on your mom, right? And she's like, oh, okay. So then they do some additional testing because something in the chart wasn't right in his mind, right? And it turns out, we got to go to a bigger hospital to do a scan. Okay, do the scan. Find a brain tumor.
Oh, gosh.
Wrapped around her optic nerve. So, I guess the nerve goes like this or somehow, and then the tumor is literally, it's wrapped around that nerve. So, high-risk surgery. She could go blind and all this stuff. Luckily, we found it. It wasn't so it was benign. It wasn't spreading, but it's a problem, right? Yeah. So, took it out.
Removed it, okay.
She was recovering for a little bit, but now full recovery, right?
Yeah.
So when the system works, we are the best in the world when it comes to critical medical problem solving. Yeah. If I had a heart attack, I would want to be right here. I don't want to be, no offense to other countries, but this is the best. We have kings and sheiks that fly into our country to the Mayo Clinic or wherever to get treated, right? But in terms of chronic preventative issues, which I'd love to talk to you more about, that we're like, I don't want to say last, but we are down there.
I think where it becomes really like the differences become really apparent is when I go to Korea and when I see the ridiculous amount of preventative effort that they put into their people. Like if you have a stomach ache, you're in the hospital. Like you can go to the hospital, you can get care. They don't charge you much at all. Like it's so cheap to just go to the hospital for really anything. Of course, Korea's, big on diets, on health. You see those commercials all the time. Take this ginseng this, or take this, extract for great this here and there. And Korea's just very good at that. And you just see just such a different system out there. When I come here, it's like, what the heck is going on? Like, I feel like they're not, I don't even know if they're testing for all of the right things. Like you and I both had to go alternatively, right? We went through Merrick, this guy Derek, who created that. Well, basically, it's like you can get your own testing and you could pay kind of a la carte. So it's like, oh, I want to get my thyroid panel checked, or I want to get my cholesterol panel checked,
like blood panel testing.
Yeah. You go to your PCP. You're like, hey, can I get this checked? A lot of them, they're like, oh, no, you're not in an emergency situation, so we're not going to give it to you. And so you have to like kind of finagle your way to get yourself tested for some of these things that you feel like are an issue. You could bypass that by going to Merrick Health. This is not like a commercial for them. We're not being paid by them.
No.
We've just used them a lot. And I ended up checking for so many things that my doctor would have never checked for.
Yes.
So many things. Pregnenolone, DHEA, my LP(a), my ApoB, right? Things
what does that all mean,
okay, testosterone. This is a big topic for men, right?
Yeah.
What do most doctors test for? Just your total testosterone, right?
Yeah.
But they don't test for free testosterone, which is the testosterone that's actually utilized, right, for functioning. We checked our free T. It's on the lower side, right? And then it's like, okay, why is it on the lower side? Well, it's because we have high SHBG, which is the sex hormone binding globulin, right? And so all these things that we discover, and then there's you got to take boron to offset some of your SHBG that could then increase your free T, which I have actually increased my free T because I've been taking boron regularly. These things are not tested regularly. I feel symptomatic, whether it's like low sexual desire, or whether it's brain fog or whatever it is. I felt like something was off, and I started to take some of these supplements. I'm like, oh, I actually feel a lot better. Oh, yeah. Like I'm starting to feel a difference here.
Oh, for sure.
But then my doctors only would check my testosterone, which is not an accurate. Like you could have 1,000 testosterone but have low free T, and it's like, I'm not saying it doesn't make any difference, but it's like that's going to affect you and impact you. And so I feel like there's definitely a difference in just preventative and just in our testing and making sure we don't actually go to the hospital for these emergencies. I think there could be so many preventions just by knowing what exactly is going on in your body. And I think that's where it's like a lot of my frustration is that doctors really care more about, here's the emergency problem, let's go fix the emergency problems. But they weren't really, I think there's a couple of frustrations, like how much were they trained on preventative care, diets, and things like that. I feel like from most of the YouTube doctors I've heard, they're like, yeah, they don't teach us this stuff. And then the second, right? It's like,
that's what doctors say, not us in medical school. They don't. Yeah. I think nutrition, somebody said they cover like a month or a couple of weeks on. It's like, okay.
But it's like, what? Like,
it's a system. Yeah, it really is.
It's a system. Let's not give them like even a supplement. Let's not give them the supplement. Let's give them this drug, right? And that's frustrating. I think another frustration, like you tell me if this is true based off your vantage point. I feel like you go through the medical system that is changing all the time. I mean, they're doing double-blind placebo, studies all the time. I'm reading the NIH all the time. I'm reading these studies because I'm so interested. I actually understand how to read an abstract now, how to read the conclusion. And I only do that because I feel like I want to know if this is actually legitimate and how much more legitimate than, the NIH. And so, how many doctors, like after they went through all this schooling, are continuing to learn what the latest are? I know they go to like conferences and whatnot, but it's like there are some studies, like even cancer research, that is constantly evolving.
Yes.
But they're like, how many of them are like just reading through all that, or are they just simply, going through what they read in the textbook that now is obsolete because there's new breakthrough findings or technology or, different kind of medical or like even supplementation, nutrition findings that they just don't really know about, right?
And they're so busy, like they don't even have time.
When I talk to some of my doctor friends, I mean, they're so exhausted after seeing
crazy.
35 patients a day or whatever, 90 patients a day, that they don't, for them to go ahead and just continue to read more and to learn about the latest every single time that's so hard. You can't blame them. So that's what I'm seeing. It's like, man, they're not, up to date. I mean, my doctor was saying the most heinous things, saying I do a barbotage on my shoulder where I suck the calcium out. And it's like, he totally took that out of his butt. It was completely, I know it was completely untrue because I researched it. I also talked to 3 other doctors who was like, what? That's ridiculous. Like that's not a thing. You can't just suck out calcium. Like that's not, it's like infused within your tendons.
Yeah. Who do you trust? Where do you go? Like, how do you know, how do you kind of take responsibility, I guess, to head toward the end of this conversation?
Yeah.
It's like, how do we take responsibility and what do we do? There is I just looked up a book that I think I reread parts of multiple times. There's a really good medical doctor named Peter Attia that we've talked about that I personally follow. He has a podcast called The Drive, where everything is very evidence-based and just like you're taking a college course, right? I'm not trying to promote him, but for me, he was very organized in all the things related to health.
Yeah.
This is what's old. This is what's new. In fact, he talks about this concept of medicine 1.0, 2.0, and 3.0, right? Medicine 1.0, dark ages, cadavers, like never have seen inside a body.
Yeah.
But you pray to the sun gods, like that kind of thing. And some of it was probably true, right? You take this herb and you feel better or whatever. Medicine 2.0 is where we basically are almost out of, which is evidence-based practices, trial and error. Okay, let's wash our hands before we deliver a baby because then the death rate of the mother goes down.
Yeah.
Whatever. But then medicine 3.0 is with all of this new data that is coming out on a daily, weekly, monthly basis, like you said, how do you understand where the trends are going? And for that, you have to take responsibility. Like you have to take the research into your own hands.
Like the patient?
I think so.
Okay.
Us as patients. Yeah. When you walk into a hospital and you're just looking at the doctor, like solve all of my problems, I think if you're lucky, it could work out. It could. But not over the span of your life and for all the problems that we will probably have as we get older, that our parents will have, our kids will have, right? I mean, again, we're lucky to have doctor and nurse practitioner friends. We just ask, hey, what do you, they give you both the pros and cons of everything. But in terms of, okay, how do we take back control? I think it is research. The one thing I do know, because I was pre-law, is how are the most impactful decisions made in the Supreme Court justice level, right? We're talking, abortion. We're talking segregation. Like all these big landmark decisions. There's 9 Supreme Court judges, and you just have to have a majority. So if you're reading like why this law was passed, 4 people could have been against it, and 5 judges could have been for it. And medical studies are sometimes like that. like you've read the NIH, all these abstracts. Sometimes the data just says most of the time the rat or the human produced this result. That's what the doctors are also dealing with too. Maybe they have read some of this, but they're like, I can't lose my license over this.
Yeah.
I can suture your wound. There are techniques to do that. I can, take a tumor out. But anything preventative and a little bit beyond that immediate, like I can feel it and see it.
Yeah.
I think that's where they're like, I need to feed my kids. I need to, I have a wife. I can't be sued.
The liability. Oh
Liability,
my gosh.
right?
That's another thing that they have to deal with.
It's so much. Anyway, so I think that by taking responsibility, we just talked about this in our other video for contractors, but just knowing the other side of the fence, researching, like Merrick Health is such a great resource because they've coached both of us on what these blood panel markers mean. And okay, you can't afford like $1,000 blood panel. That's fine. There's a $105 blood panel that you can take. There's a $250 doctor fee so let's just say like $400.
Yeah.
Okay. You already have a deductible. Like, I don't know anybody who doesn't have a deductible unless they're paying some ridiculous amount. So use some of that deductible money on your own health, get some of these tests, learn one marker, one thing, and talk to your doctor about it. And I found personally, I don't know about you, that when I've been studied and I've taken these things to the doctors I've dealt with, the conversation is so much richer. Like I talked to a doctor about stem cell research because I was like, hey, what do you think about the new stem cell research? And he's like, well, this has been proven in this case. It hasn't been proven in this case, but I've studied that this is it and this isn't it. And I'm like, that was so fulfilling because it wasn't just like a do it or don't do it. It was a discussion between a professional and myself. That's what I would say. I mean, what would you?
Yeah, and we got to kind of wrap this up. I have someone coming here in about 5 minutes. One last thing I would leave with people, because we're in the age of technology, is I believe people should utilize AI a lot more. Doctors hate it, by the way. A lot of doctors don't like it actually when you research on Wikipedia and you come in with a bunch of Wikipedia answers. But there are, I think it is our responsibility to do our own research, and research is really tough because there's so much stuff out there. What I've been using is Perplexity AI. Again, not another commercial, but I've actually been asking Perplexity AI on a lot of my questions and researching a lot of studies.
Yeah.
I've heard that, I have a problem with LP(a), and not a lot of people know about lipoproteins, right? Some doctors don't know about lipoproteins, but then I'm asking about, okay, like, is this really a big deal? Oh, I should be under 40, by the way. That's normal. My LP(a) is at 260 right now, right? So there's a 46% risk. If I'm in the 90th percentile, there's a 46% risk of me having atherosclerosis, cardiac disease or whatever that is, right?
Yeah, heart attacks, strokes.
Exactly. And then if I have diabetes, that goes to 92%. Okay. Wow. My dad has diabetes. My grandfather has diabetes. So like I could have a heart attack, like it's a big deal. And rather than asking my doctors, because a lot of people, they're just like, I feel like they don't care. And I actually asked, I'm working with, I hired like 4 or 5 health coaches. One of them, she has 3 PhDs. All she studies is lab work, right? She does a 90-page write-up on lab work. That's how much she studies the labs. And I asked her, I'm like, what is going on? Like, is this like, why aren't people taking this more seriously? Like, I feel like I have a big issue. Why do I feel like my doctors really don't care? And they're saying that, she's like, it is a big issue. Like you could have a heart problem. It's very clear. The studies are clear. And I had to look online. I had to look on Perplexity AI to figure that out. She's like, but for some reason, the medical industry is just, like there's not a drug that they can sell on it yet, which there will be.
Sure.
It's coming out in May. But until there's like an incentive there, they're probably not going to push it. So all that to say is like, just kind of going on top of what you said, just ask AI, like give them your symptoms. I'm dealing with this, this, and that, and just kind of do your own research. Okay, maybe I should get this blood test that only costs $30 rather than doing a full panel. Ask your doctors. You already pay for your insurance. Ask them to try to convince them to get these blood tests, to get some of these tests on yourself, if you can. And so, anyway, we got to end there. Please like or subscribe at the end of this video. It really helps our algorithm. Sorry, we have to cut it short, but I do have someone here currently. So,
All right.
Thanks for watching, guys.